Gracias, Maribel. Buenos días, everyone. Good morning, everyone. It is an honor and a pleasure for us to be here very early in the West Coast, but it is an honor for us to be here in this space and share this space with you. I want to with very quick introductions about who we are and what is our purpose today. But before we do that, I want us to all just take a moment to take a deep breath. Inhale and exhale. And let's just arrive and be thankful for the opportunity that it is for us to be here in this space together. What a miraculous experience it is that despite the challenges of this last year, we are still able to come together. For many of us, our last conference was the Northwest Regional Conference last year. And, it's a blessing to be able to do it again with other colleagues, with other partners this year. So thank you. And I want to first also start saying thank you to Maribel and thank you to Soraya and Adam that are able to help us today. So I would like my team to introduce themselves, and I'm going to start with Alejandra, and then I will introduce myself last. Alejandra, if you can just share a little bit about yourself.
Sure. Buenos días. Good morning, everyone. I'm Alejandra Ferris. I'm a fourth year graduate psychology student out of Pacific University. I'm on the Health and Sabiduría emphases. I moved to Oregon from sunny Miami, Florida, and I'm originally from Venezuela. It is an honor to be here today with my colleagues and to be here with you to share some of the great things that we have been up to.
Yeah.
And I will pass it to Alex.
Thanks, Alejandra. Buenos días a todos. My name is Alex. I'm a second year graduate student in the PsyD program at Pacific University in the same tracks as Alejandra, Health and Sabiduría. And I am here in Oregon, moved back in 2019, but originally from Pumpkintown, South Carolina. So hello to Aiken, glad to see you here. And I'll pass it to Joanna.
Hola, buenos días, everybody. My name is Joana Cendejo. I am a second year graduate student at Pacific University in the School of Graduate Psychology. My tracks are the child track and the Sabiduría emphasis as well. And I moved, like everyone else, from a far away, not from Oregon, but in Oregon now. And I am from South Texas. Thank you for the opportunity to be here, and I look forward to this presentation and being here with you all.
Buenos dias, I'm Savannah Leyda, and I'm also in the same program from Pacific University, and I'm on the Health and the Sabiduría track, and I moved here from Wisconsin, and I'm excited to be here and to present in this conference. So thank you for having me.
Thank you. Thank you to my team. And my name is Ruth Suniga. I am faculty member at Pacific University, and you heard the students sharing information about Sabiduría and what it is. We're going to talk a little bit about it today, just briefly, because that will explain a little bit of the work that we do and how we are being able to incorporate outreach, service learning to bring emotional health and wellness to our communities, to our people, and especially the Latinx community. Besides a faculty member, I am a mother. I am an immigrant from the land of the Malecos and the Chorotegas, meaning Costa Rica. Pura vida, that's what we say for many of us in our country, and it is an honor to be here. I would like to, we're going to be sharing the PowerPoint here and there, but I want to encourage you to seek and look at the PowerPoint later on for more information about who we are in our program and so forth, and to see the learning objectives for today. But our idea is just to present the model that we have created throughout the years in academia to be able to serve the emotional health and mental health needs of communities in our communities and what we have done. And we want to share some of the challenges, some of the experiences that we have had, and also some of the learned lessons. And hopefully by the end, we also have an opportunity to do some small breakout rooms to talk more about this. As students were mentioning, we're part of this program called Sabiduría, but just to understand, we are part of this larger university in the Pacific, not larger, it's a larger program, but it's a small private university in the Pacific Northwest in Oregon. And within that program, there is a graduate psychology program, which is rather large, one of the largest in the Western, in the Northwest, and focus on training clinicians to become mental health psychologists at the master and at the doctoral level. And within that program, we have created a small program called Sabiduría, which Sabiduría is a program that focuses on training clinicians to work with the Latinx community in a way that is linguistically and culturally informed. We are one of only 10 Latinx psychology programs in the nation, and we think that the students also provide services in a clinic. We have 2 training clinics with about 70 students, clinicians that are providing services. And within that clinic, one of those clinics, we serve a predominantly migrant and immigrant Latinx community, and therefore our work for outreach and serving this specific community is so important. So that's about us, and this is who we are representing today. And today we will just talk about, again, what is it that we have done and so forth. Joanna, I think the turn is yours next.
Gracias, Doctora Zúñiga. And like Doctora Zúñiga said, we're just going to be sharing the slides momentarily, but most of the time this will be sort of like a conversation. So as we know, Latinx individuals are less likely to seek mental health services, although we know that they experience mental health disorders at similar rates to other groups in the United States, including dominant cultures. And very small amounts of Latinx individuals, as we know, will actually go and talk to their doctor, and even fewer will contact a mental health professional about their symptoms. And another important thing to note is that amongst the Latinx community is the Hispanic or immigrant paradox, which has found that although Latinx immigrants experience a multitude of unique stressors and trauma en route to the United States, it's actually been discovered that the US-born Latinxs actually seem to experience more mental health disorders than Latinx immigrants. Specifically, we see more major depression, anxiety disorders, PTSD, and substance abuse disorders. And these results suggest that actually factors or stressors uniquely associated with living in the United States are related to those increases in mental health disorders. And we'll talk about those factors and stressors in a little bit. And in regards to Latinx youth in the United States, we know that they're generally at greater risks for difficulty with like anxiety, depression, and problem behaviors compared to other groups of youth in the United States. Specifically, we know that Latina girls in high school have demonstrated higher suicidal behaviors in comparison to other groups. And one of the most notable findings is that with all Latinx individuals, we know that they've experienced or are continuously experiencing some type of trauma, a majority of the Latinx individuals, and very high percentages of Latinx individuals. So this could be, of course, sexual, physical abuse, emotional abuse, but this does not disclude immigration trauma, discrimination, marginalization, and racism at both individual and systemic levels. And when we consider the fact that Latinxs often underutilize and access mental health services, we do know that these rates may even be an underestimation. Slide, please, Alex. Perfect. Thank you. So in regards to Latinx migrant farm workers, they too struggle with mental health problems. Specifically, what we see is depression and anxiety. And in Oregon, where we are, we see higher rates compared to the US in general. And depression, of course, can not only lead to hopelessness and thoughts of suicide, but it's also associated with many other health complications, such as chronic diseases such as diabetes. And many different factors are associated with depression and anxiety that we know of. However, in migrant farm workers, depression and anxiety may specifically be associated with a few things, such as a culture rate of stress, like when an individual doesn't feel completely assimilated or comfortable to the dominant culture, and their culture may clash in a negative way with the dominant culture. Could also be poor family functioning, such as a lack of communication amongst family or frequent arguing, or lack of social supports. And this is especially applicable to this population because often they have to move constantly for work and may not ever have the opportunity to establish much needed connections. And as we know, migrant farm workers have been disproportionately affected by the COVID-19 pandemic. It's created new stressors for this population and has also unveiled standing barriers that these individuals face on a daily basis. We know that they're at an increased risk for outbreak and exposure to the virus due to long work hours and unsafe living conditions. And they often lack basic protections, such as access to healthcare coverage, insurance, and even the stimulus funds that we have received due to the pandemic. And for many of these farm workers, this has not only perpetuated systematic and institutional barriers, but this is especially true for those who are undocumented, which has caused elevated fears surrounding the ability to access services and discrimination. And these factors also play a large role in the barriers that migrant farm workers face in regards to accessing mental health services. Farm workers face anti-immigrant policies. They often do not have insurance. And when we think of the rural areas in which they work most of the time, there's often scarcity in available services, right? But if services are available most of the time, which is rare, they are still likely to encounter language barriers and a lack of culturally appropriate providers. And stigma surrounding mental health also creates barriers in accessing mental health services, such as mistrust for mental health providers and a lack of credible information about services. And it's also important to consider how these barriers are combined with the risk factors that we talked about unique to this population, like the low social support, a culture rate of stress, and stressors that disproportionately affect them, such as COVID-19 and even the recent wildfires in the West Coast. Slide, please, Alex. I believe Dr. Zúñiga.
Yeah, so one of the important things, if we ask you all, what have been your experience in regards to the mental health system in the US? And maybe some of you can type in the chat what has been some of your experiences. And I think the majority of us can say that there are several things in regards to mental health services for Latinx individuals, and especially for migrant farm workers. And as Joanna was mentioning, one of the things is the lack of access to care, the issues with the stigma, the aspect of mental health being rather expensive or not accessible for our community. And the barriers are significant. And one of the things that we have noticed as well is that even if we tend to remove many of these barriers, such as lack of insurance, the aspect of the cost of care, we still recognize that many of the treatments that are available for mental health are not culturally appropriate. And especially when it comes to evidence-based treatments, many of these evidence-based approaches were developed and have been developed with dominant culture. And therefore, it just places many of the values of the dominant culture into our people, into our community. Another thing that is important to understand also is this idea that we may think that we have this idea about mental health, that people have to come and seek those services, and they have to be the ones navigating all the barriers, and it puts the blame on the individual and not recognizing that many of the barriers are systemic, structural, and institutional. And therefore, we have seen a push and a movement to see mental health in a different way, to see mental health not only as mental health, but as an emotional health, as health and wellness. Another aspect that will be important is to also think about equity and equality in regards to mental health, that the aspect of just providing a service, that it is in somebody's language, that doesn't mean that that is always is a good step, but that doesn't mean that is what the only thing that the person needs. The person may need other services in order to be able to access that that service. Another moment that we are seeing is to recognize that we as people of color also deserve emotional and mental health as the dominant culture. And therefore, we have to reclaim, and we are reclaiming mental health as part of our own health. And one of the aspects that we are trying to do this in our program is to also think about bringing mental health to the people, not only expecting the people to come to us, but we also coming to them, and we clearing the path for emotional health for the community to be able to access these services in a way that is appropriate. And today, that's one of the things that we're going to be talking about, what has been on some of the things that we have done to, people call it selling psychology away, but we actually like to go giving psychology away, but we actually think about it that it's not that we are doing something and giving something. It is a collaboration between the community and us together, creating and co-creating a new way of seeing mental health and emotional health within our communities, and especially within the migrant communities here, Latinx migrant communities here in Oregon. So that is exactly why we think that as the fundamental component of mental health, we have to bring outreach as the first component of bringing mental health to the people. And Savannah is going to discuss a little bit about that.
Gracias, Doctora Zúñiga. Okay, next slide, Alex. Thank you. Okay, so social justice and advocacy. These are two very important components to outreach, and when utilizing these values, we seek to create and implement practices that target institutional and systemic barriers. And the reason we're targeting them is because these barriers are what create obstacles for underserved communities and limit their access to resources. So as graduate psychology students, we're in this unique position to mediate the relationship between systems and the community to create more equitable health systems. Thank you, Alex. Okay, so why do we do outreach? Our primary goal with doing outreach is to decrease human suffering and promote human values of equality and justice. And we're interested in reducing health disparities, social inequalities, and social problems. And some of the ways we do that are by supporting local communities and engaging in underserved communities and bringing mental health to the people. And all of this helps contribute to the equity while also removing that pedestal that providers and health workers can sometimes be put on. And we're moving to increase the utilization of healthcare services by underserved communities, and additionally make emotional and behavioral health information more accessible and reduce mental health stigma. Next slide, Alex. Slide 15, please. Thank you. Okay. So why in the Latinx community specifically? Primarily because Latinx individuals experience these increased barriers to treatment. And so we want to remove these barriers and form that strong connection to the community. And an example of this from my experience is that when we do outreach, we go to the community. We're a university. We have the space to hold outreach events at our location, but instead we travel to local and accessible locations where the community members are close to and where they feel comfortable. And this removes the barrier of travel, as well as that hierarchical relationship, as now the experts are coming to them and making this one-on-one connection. And this is an example of what we do, but I'm sure all of you can think of many ways that you could implement removing barriers and building this trust in your own organization and communities. And I'll let Alejandra continue on that.
Gracias, Savannah. So I want to share a little bit about the types of outreach that our program Sabiduría is involved with. As part of our training curriculum, Sabiduría students are expected to participate in several hours of outreach all throughout their academic career for the entire 4 years that they're on the campus. And in the second year, particularly, which is our first official year of clinical training, we train at our Pacific Psychology and Comprehensive Health Clinic, which is a training clinic that serves the community. We typically serve low-income and Medicaid patients, and we offer a sliding scale fee for those who are uninsured or underinsured. And so the bulk of the outreach through Sabiduría is actually done by the second-year students. And so Alex, Joanna, and Savannah are members of the second-year cohort. They're in the training clinic, and so they're part of the core group of the outreach team. And so we're going to share a little bit about what we've been doing and how we have had to adapt some of our outreach because of COVID. So Alex, can you pull up some nice photos for us? Okay, so these are pre-COVID photos where we were able to go out into the community, as Savannah said. And so we have our table with multiple resources, which are not always the same resources depending on which site or which location we're going to. So if we're going to a community health fair that is dedicated to children and families, we're going to have a lot of coloring books. We're going to have like the rueda, the raffle wheel that you see in the top left corner, where we have kiddos identify certain emotions they might feel. We give away stress balls. The photo with the wooden backgrounds, that is at a local vineyard here in the Willamette Valley in Oregon. And we'll talk a little bit more about those kinds of experiences a little bit later. But we do tabling at these migrant farm worker vineyards, and they can come, and we have health resource fairs, and we talk about our services. We provide psychoeducation. We connect these folks to referrals and services that they might need. And then the top right corner, we have a table that we put out for our Chatras. And so we'll talk a little bit more about our Chatras, but this is a different outreach table where it's more focused on a particular topic that is the theme of the psychoeducation talk. And so we have multiple topics that we give throughout the community. You see there, it says la depresión, but we also talk about el manejo del estrés as a way to introduce mental health and emotional health to the community. We talk about crisis and suicide. We talk about domestic violence from the perspective of how to build healthy relationships. And we talk about what substance use in the community looks like. And all of this is to open the door to conversations. Can we go to the next slide, Alex? These charlas help open the door for conversations to be had in the community. As Doctora Zúñiga said, we're trying to reclaim mental health. And part of this is we need to talk about it because there's a lot of stigma. And so the charlas are held in community spaces. I think the one with the globos, with the balloons, that's a dinámica that we did. And that is being held at one of the local churches. Up in the top right corner, that is at a community center in a more rural part of the Portland metro area. And then down below, we have dinámicas related to Zumba warm-ups and an interactive activity that a promotora is actually leading in the bottom right corner. And so this is a reflection of the collaboration that we have with promotores de salud who help facilitate these charlas. And we tag team with them and go into the community, into their spaces to have these conversations. And these conversations are always free to the public. There is no charge. We have raffles. We have different incentives to bring folks there to kind of just encourage sharing this space so we can talk about these topics. But this is what outreach looked like pre-COVID. So I think we have a couple more things to talk about, and then we'll talk about how we've adapted outreach. And so previously, when I mentioned that we were going to the vineyards, this is part of our interprofessional service learning, which is a part of the training component within the Sabiduría Latino psychology emphasis. And so this is another way where we're bridging the community to services. We're removing that barrier, removing that hierarchical stance, and we're really just going in as members of the community to meet with members of the community. And so part of this is an interprofessional diabetes clinic where we serve uninsured patients who have diabetes that are typically monolingual Spanish speakers. They come to our training clinic and they see a number of disciplines, including psychology, where we take the role of behavioral health, which is really new for a lot of our folks. And it's kind of a great way to open the door to introduce them to mental health because they're more used to seeking providers in a medical setting if they do actually get to a treatment setting. And then we have the Salud program, which is a collaboration of wellness clinics that serve Latin migrant farm workers that work in the vineyard industry in the Willamette Valley. And so every summer before COVID, we would visit, I don't know, doctora, 10, 15 vineyards and provide psychoeducation, provide mental health screenings. We've had to do crisis intervention while we're there during some opportunities. And so these are some very unique learning experiences, not just, academically and professionally, but also personally for us to get to know who lives in the community that we serve. And so all of this is pre-COVID, and I want to talk a little bit about how we've adapted some of our outreach this year because of the pandemic. Oh, sorry. Prior to COVID, we were giving in-person trainings. And so we have also trained, community partners from immigration lawyers who want to learn more about vicarious trauma and how to better handle some of the stories they're hearing. We talk to educators about some of the issues they might see related to generational or acculturation clashes in some of their students. We've talked to suicide hotline personnel to understand how to incorporate Latino cultural values when they're serving Latinx callers. And so we just have a lot of different partnerships throughout the community because so many different organizations have, come up in order to serve to fill these gaps in service provision. And so it's part of our job to bridge the services to the community by letting them know, like, hey, these are all these other services available to you. It's not just us as mental health. We're not gatekeepers to any of this stuff, but instead it's this web, this network where we're just connecting and referring community members and also our community partners to community members. Next slide, Alex. And so other forms of outreach, beyond just going into the community involve things like service drives. So earlier in the year or late last year when the wildfires hit, we did start a wildfire relief drive for the farm workers and firefighters that were impacted by the wildfires in the Willamette Valley. We go to community organizations and help build Thanksgiving baskets, serve Christmas meals. We participate at local public festivals like health fairs, but also larger city festivals that are targeting the Latino community, like Dia de los Muertos, like the city of Hillsborough's Festival Latino. So our students, we are in the community, we are mingling with folks. And so we're really trying to kind of lift the veil on, who is a psychologist and what does a mental health provider look like? We're just trying to be in the community so that they can see us and we can hear them. And so some of the ways that we've adapted outreach, and I'll let Alex add a little bit to this, but some of the ways we've adapted outreach is transitioning to a virtual platform, which at first felt really scary because we know some of the technological barriers that our community faces. Just technological literacy is very different across the community. And so trying to figure out how we were going to get to folks, how to get mental health to folks. And so we figured that we could adapt our Chatras from in-person to giving them on Facebook Live. And so we set up a Chatras Facebook page, and we have them probably every couple of weeks. We're going to have one next week. We're talking about the fear and anxiety related to returning to classes and how our Latino parents are dealing with some of those stresses. And we've been offering and adapting our trainings to give them over Zoom, just like we've adapted this conference to get together and present over Zoom. Alex, can you add a little bit about what else we've been doing during COVID to adapt our outreach efforts?
Yeah, gracias, Alejandra. We've been trying a lot of interprofessional collaborations, a lot of trainings, provided through Zoom, doing more outreach that's focused on material aid like Alejandra shared, a while back, you saw some pictures from a outreach drive to the farm worker community in Medford. So that was a big part of it. This is in the middle here. You see some of our colleagues. Joanna, notably, there presenting to local news about some of the needs for displaced folks down in Southern Oregon. And I'm going to just go ahead and share briefly about some of the experiences our clinicians have had with outreach. So some of the things to note is that outreach for us has really gotten us more comfortable going out into the community, getting an increased knowledge of our community partners, which then leads to later collaborative opportunities. It's provided a lot of insight into the community's experience and increased the cultural sensitivity of our service delivery. But along with that, some of the major challenges have been developing those partnerships. It takes a lot of time and effort. And we're very blessed in this program to have Dr. Zúñiga and Alejandra, who've had lots of years of working with the community. Outreach, especially now, requires last-minute organizing. And often you work outside of traditional 9 to 5 hours. So it requires a ton of flexibility. We're also navigating systems that are meant to serve dominant culture in this country. That can be a barrier often. And outreach is not really a part of traditional training in health services. So we don't really talk about these topics. And then during COVID, we've had limited contact directly with community members and some of the access barriers that Alejandra mentioned. And then other successes have just been that once you put in once you become more flexible, you can really tap into the creativity in the community. You can see such positive results. We've reached a record number of people, and we've connected a lot of people with services and reduced barriers. And we're really bringing the values of our ethics and accessing and helping folks access care and really bringing equity into our work. And I'm going to just briefly share with you all some of the impact we've had in the last year. So we've done 77 total outreach events in 2020. This number, 83.5, is the total number of hours of finished outreach programming that we presented, reached 46,113 people between the ages of 25 and 85 in the US, Mexico, Costa Rica, Ecuador, Peru, Canada, Guatemala, and Colombia. And that's all thanks to telehealth and the internet this year. We presented on stress management, relationships, substance use, depression, anxiety, suicide prevention, as was mentioned before, and dealing with COVID. We've also done a little bit of work on making educational videos and some community accessible handouts. And I'm going to go ahead and pass it to Savannah and Joanna to talk about how to apply some of these practices that we're talking about.
Gracias, Alex. Okay, so we would like for you all to consider how you can integrate outreach and service learning into your work. So in general, some tools and important components that we consider when we're doing outreach are first developing these strong, you've heard it many times throughout this presentation, but developing these strong community partnerships. And these increase your credibility with the community and your connection, and it helps build that trust with the community. Next, something that we are always aware of is that there is a stigma with mental health in the community, and there's a strong preference for topics related to stress management, physical health, and somatic symptoms. And due to this, instead of focusing on mental health and using that term always, we sometimes focus more on emotional health and wellness. And finally, we try to give culturally adapted services, and we do this through consultation with cultural advisors. And so we utilize a cultural liaison in the community to ensure our practices are culturally appropriate and received well within the community. So Alex, slide please. So Alex is bringing up right now, some of the cultural values that we consider when we're creating these activities. And they're personalismo, familismo, simpatía, and respeto. And these are all terms that you may have heard before, or at least you're familiar with the definitions of once you read them. And we keep these values in mind when engaging in outreach to help better engage the community and to address them in a way that is culturally comfortable and that they're already familiar with. And this also helps building those strong relationships and trust. Okay, Joanna, you can take it from here.
Gracias, Savannah. Yeah, so as Savannah was saying, we incorporate those values. And as Alejandra was saying, there's very specific things we do in the outreach to promote personalismo, familismo, respeto. So as Alejandra was saying, we do a lot of pláticas, icebreakers, dinámicas, such as like freeze dances, raffles, we'll get the rueda out. And then also with Zoom, that's changed a little bit, but we still try to incorporate pláticas and dinámicas in a way that is that we've been able to through Zoom. So we'll do like scavenger hunts and freeze dances online. Next slide, please. And you can skip to the next one too. After the next slide, Alex. Back one more. Thank you. So yeah, this is just an example of some of the community collaborators. And we wanted to share this slide just to share that there's such a wide breadth of partners available to work with. We have medical clinics, advocacy programs, support programs, community centers such as Centro Cultural, even school districts that we've collaborated with.
Thank you. So we hope that this presentation gave you a little bit of a flavor about what outreach means and what we have done so far in regards to this outreach within our communities. As Alejandra was mentioning, for many people, this is the first time that they see a mental health provider in their setting. It's the first time that they see a psychologist, and that by itself removes some of the stigma related to psychology and mental health services. But one of the things that we would like to invite you is for you to share with us and for us to actually have a discussion in regards to how can we actually engage in outreach how can you engage in outreach in your settings? So we have two questions that we would like to explore, but the way that we're gonna do it is we're gonna do a couple of small breakout rooms. Adam has already prepared them. So we're inviting you to, Adam, if you can open the small breakout rooms. So you're gonna receive an invitation, I think, on a screen, and then you accept, and then you will be led into a breakout room, and one of each of us in the team will join you, and we will have a conversation with you about these questions, about this topic, and then we will come back to the larger group just to finalize our presentation today. So Adam, if you don't mind, please opening the breakout rooms, and he's gonna give us a warning when we're gonna be there only for 10 minutes, and he's gonna give us a warning when the breakout rooms are ready to be closed.
Okay. Yeah, so in my group, a lot of people were from a more medical organizations, and like medical or dental, and they themselves didn't necessarily have behavioral health on hand, but they had resources in the community that they would give like information for and refer people to like more integrated sites. So that was a big aspect that a lot of people from my group were talking about, is that they kind of did that. They addressed that integrated issue as more of giving resources and referring to local resources within the individual's local communities. Because also a lot of, or some of the people in my group serve people very far away. So they would find resources within their communities that had that integrated approach and had that behavioral health aspect.
Great. So that interprofessional collaboration as a way of creating bridges to resources, that in-house type of outreach, so that we can let folks know, okay, there are these additional services outside of the service that you received today.
Exactly.
That's great.
Mm-hmm.
Welcome back, everyone.
Thank you.
Were briefly sharing what Savannah's group had discussed.
Yeah. So it seems like you shared that, and I would like to, it seems like the conversations could stay a little bit longer. We could have stay a little bit longer and having more conversations, and still, yeah, we have 3 more minutes to conclude, and I want to make sure that we allow time for Q&As, for some questions or comments. If somebody says, maybe not a question, but I want to comment in regards to what we discuss in the group, that's welcome as well. But we want to be mindful of your time and also making sure that if there are any pressing questions or comments, either throughout the chat, please share them, or turn on your microphone and let us know. And I know that Maribel also has a couple of announcements to make. Got it? Okay. So questions, comments? It seems like when we are in the larger group, we got shy suddenly.
Nora had commented in the chat around lack of access. I don't know if Nora wants to speak more to that, or our colega Jaime talked about how this was a great program and how behavioral health and mental health is needed. So I don't know if Jaime wants to speak more on that either. And then Yaritza just came into the chat too, and Amelia.
Hi, everybody. I was just, well, I'm from El Paso, Texas. Just like in our area, I see a lot of because we also have Fort Bliss, which is based here in El Paso. So I see a lot of military, of course, that have a lot of problems with PTSD. And so there's just been like a lot of issues, I guess, on not having that access for our military. And then, of course, just in general, our population here, because of lack of providers, or maybe they don't take like Medicaid or CHIP, or, just lack of insurance in general. And so sometimes those individuals don't get that proper care right away. And, sometimes the referral systems, it's just a long wait for appointments, and it's care that the individual needs right away. So I've seen that a lot in our community, and it's very sad because, some people have, just such horrible issues, and they need services right away, but it's, just lack of providers and, insurance. So sometimes that's really hard. And there was an issue like maybe 2 or 3 years ago here in Fort Bliss, where they just didn't have the appointments, and an individual went into the base and he shot one of the doctors. So it was really sad to see that. And just because, there was just lack of appointments. So I just see those issues sometimes, and it's just really sad to see.
It is overwhelming, and especially for many of us as community helpers, being able to see the suffering of our communities, and at the same time feeling a sense of powerless or helplessness, that there is not enough of us, there is not enough of the services available, and we need more. And one of the things is we still, I believe, can, with little by little, drop by drop, we can build something. And so we are showing just one little something that we have done, but there are many other ways where hopefully we can start empowering our own communities to engage in little by little in their emotional health. And so it is hard, and we need more of this. We need advocacy. We need to focus at the legislation level as well and start advocating more for people to serve our people, and hopefully by our own people. So that's one of the areas that hopefully we can put a little bit of granito de arena and start doing that as well, because it's devastating and painful what we see. So thank you, Nora, for sharing. We have a question here from Leanne. What do you think has been the single most successful adjustment you were able to make during the pandemic? I will add it into two things: continue collaboration with community agencies, and actually that have enhanced more opportunities. We have a lot of demand for training, charlas, and all of these aspects of being able to provide support to the community. So continue and enhance collaboration. And I didn't like to say it, but social media has been the prime. We have to bend a little bit what we did. We started with a lot of disclaimers, and as a psychologist, we have a lot of ethical standards and difficulties, but we were able to navigate it and adapted that. And we actually are presenting later today about our charlas. And through our charlas, we may have hundreds of people join, and the community is still interacting and asking questions. So not where we were thinking, but I think that those two adaptations has been the one. And maybe Alejandra or Savannah or Joanna or Alex want to share about what has been the most single thing that you consider. I consider it's not a single, but you cannot separate collaboration from this work, and then using social media.
Yeah, I think after many, many long hours of learning how to do Zoom on Facebook Live, it has been such a great success. We've adapted and readapted based on the feedback that we've received from, participants in the audience, but also the promotores that we're collaborating with. And so we have 30-minute charlas on Facebook Live, and we raffle gift cards, and we are reaching, people outside of Oregon. And that's what we're trying to do, is we're trying to help Latinxs reduce that stigma and start talking about these issues. And it has been so gratifying, so honoring to just see this movement take on, and to see the excitement behind our charlas.
So thank you so much, everyone. It's 9:00. We appreciated you spending time, 9:00 our time, spending time here. Thank you, Adam, as well, and Maribel and Soraya for helping us today. And thank you, everyone, for being here with us and sharing this space.